Hello, my name is Dr. Wissanji and I'm a pediatric surgeon at the Montreal Children's Hospital. Today I'll show you how I perform a pilonidal abscess drainage with local anesthesia only in a child while minimizing pain. So here's a picture of the anatomy. The patient is positioned on their tummy with the head to your left and the feet to your right. You'll see the abscess just above the intergluteal crease. To provide distraction for the patient and decrease pain, I have a habit of playing a playlist of their choice so we can listen to music together while the procedure is ongoing. The material needed for this procedure will be a pair of sterile gloves, chlorhexidine wipes, xylocaine, a 5cc syringe and a small needle, a 10cc syringe and a medium-sized needle. I'll also be using a 16-gauge needle. I'll need a blade, saline water, an Atson grasper, and a pair of scissors. The first step will be to prep the area with the chlorhexidine, and then we'll start with the local anesthesia. Use your small syringe and needle to begin the anesthesia. One of the tricks to decrease pain is to decrease distension of tissues. So if you use your smaller syringe, you have better control over the pressure and you can do a very delicate local anesthesia with minimal pain. The next step will be to complete a local anesthesia using a square shape surrounding the abscess. I typically bend my needle on the table to facilitate the infiltration of the subcutaneous tissues. Another tip to decrease pain is to always start from a region that is frozen to a region that hasn't been frozen yet. In this way, you'll really minimize the amount of discomfort for the patient. Then one of the critical steps is to identify appropriately the abscess. I use a 16-gauge needle to puncture the skin and aspirate the abscess using a small syringe. This will ensure that my incision will be at the exact area where the abscess is lying. I then remove my syringe and leave the needle in place. I then proceed to cut the subcutaneous tissue in a lozenge shape centered around the needle. The needle is removed and I use a pair of scissors to cut the posterior aspect of the subcutaneous tissues. There will be spontaneous drainage of the abscess, which I irrigate with NS. Another tip to decrease pain is not to insert any mesh. It will cause a significant amount of discomfort for the patient because the posterior aspect of the incision hasn't been frozen. But you do need to recommend to the families to proceed with sitz baths 3 times a day and apply a dry dressing in between. I hope I was able to share a few tips and tricks on how to proceed with a pilonidal abscess drainage in children while minimizing pain.